Good day. I am Junaida P. Haji Khalid and I'm going to discuss the hookworm infection. So, what is hookworm infection? It is an infection of the intestines that can cause an HRS, respiratory, and gastrointestinal problems, and eventually iron deficiency anemia due to ongoing loss of blood. People can become infected when walking barefoot because hookworm larvae live in soil and can penetrate the skin. Hookworm is a parasite that causes infection in people of all ages. It enters the body through the skin and can lead to a number of complications. So, pag nasa lupa tayo, we should be more careful kasi maaari tayong ma-infect ng hookworm infection. And also, hookworm is most likely to occur in a moist, hot climate. However, they occur in many locations around the world. According to the Centers of Disease Control and Prevention, CDC, between 576 and 740 million people worldwide have hookworm infection. It was once common in the southern part of the US, but improvement in living conditions have reduced its occurrence. However, whatever human and animals live together, including pets, infection is possible. So, kailangan talagang lagi tayong careful. Dapat alam natin how to prevent sa ganyang mga pangyayari para hindi tayo ma-infect. There are different species of hookworm. The ones that infect humans include the Ancylostoma duodenal and Nicetor americanus. So hookworms can enter the skin when a person comes into contact with contaminated soil. So kailangan talaga pag nasa lupa tayo is hindi tayo naka-barefoot kasi maaari tayong ma-infect with the contaminated soil. So that can cause to hookworm infection. Kaya kailangan be more careful. Transmission. So, paano ba natatransmit yung hookworm infection? So, hookworm eggs are passed in the feces of the infected person. If an infected person defecate outside, or if the feces from the infected person are used as fertilizer, eggs are deposited on soil. They can then mature and hatch, releasing larvae. The larva mature into a form that can penetrate the skin of human. Hookworm infection is transmitted primarily by walking barefoot on contaminated soil. One kind of hookworm, the Ancylostoma duodenal, can also be transmitted through the ingestion of larvae. The hookworm can spread when a person has an infection defecates in the soil or when people use human feces on soil as a fertilizer. So if eggs are presented in the feces, they can hatch after 1 to 2 days under the right condition. So after hatching, the larva can survive for 3 to 4 weeks in the soil according to the Merck manual. They take 5 to 10 days to mature in the soil. So when person come into the contact with this soil, hookworm larva can pass through their skin. So this can happen if the person walk barefoot on the soil that contains the larva, swallow soil particles, for example on unwashed salad leaves. So pag maaari kang ma-infect pag wala kang, if you walk barefoot on the soil or pag you swallow that particle na hindi pa siya nahuhugasan. So dapat lagi mong hinuhugasan kung ano mang kinakain mo na galing lupa para hindi ka ma-infect. So after entering the body, the hookworm larvae make their attach to the small intestine and gain nutrients through human blood. In some cases, the person may develop anemia as they lose blood to the hookworms. Worms may live for over 2 years. Mating also occurs in the small intestine. From here, thousands of eggs can enter the human feces. So, yung mga hookworm, they multiply and then enter thousands of eggs can enter the human feces. And also, hookworm cannot pass to another individual through personal contact. Infection can only happen when the egg mature into larva and soil. Walking barefoot on a soil can expose a person to hookworm. So what I said earlier, that when a person comes into contact with this soil, the contaminated soil, hookworm larvae can pass through their skin. So kailangan talaga hindi tayo dapat naka-barefoot para hindi tayo ma-infect. Dapat malaman natin yung mga prevention para hindi tayo ma-infect ng ganyang infection. So mamaya matatalakay din natin yung mga prevention and symptoms. So what are the risk factors? So certain people have higher risk of contracting the parasite. So these include those who live in warm, tropical and subtropical areas, people who spend time in areas where there is poor sanitation, management and hygiene, especially if walking barefoot or with skin to soil contact. Also those who are pregnant of childbearing age, young people who had contact with contaminated soil or sandboxes, workers who had contact with contaminated soil, especially farmers, a plumber, electrician, and exterminators, and people who sunbathe on a contaminated sand. The risk increase in areas where people use night soil or fertilized meat from human feces. Symptoms. So what are the symptoms? People with hookworm infection may show some of the following symptoms: a skin rash in one area that is typically red, wrist and itchy, weight loss, loss of appetite, breathing complications such as wheezing and a cough, fever, stomach pain, extreme tiredness and weakness, iron deficiency, anemia, or malnutrition, physical and thought development problem in child due to severe anemia, heart failure, and widespread tissue swelling as a result of severe anemia. So, the itching and localized rash are often the first sign of infection. These symptoms occur when the larva penetrate the skin. A person with light infection may have no symptoms, and a person with heavy infection may experience abdominal pain, diarrhea, loss of appetite, weight loss, fatigue, and anemia. The physical and cognitive growth of children can be affected also. Diagnosis. A number of tests can help diagnose a hookworm infection and its effects. These include a number of samples to check for hookworm eggs, blood sample to check for presence of anemia or a lack of certain nutrients. Healthcare providers can diagnose hookworm by taking a stool sample and using a microscope to look for the presence of a hookworm eggs. Treatment. A doctor will normally recommend taking certain medication, albendazole, mebendazole, or pyrene sulfamide, for 1 to 3 days to treat the parasitic infection, according to CDC. These drugs are antihelminthics or anti-parasitic drugs. Also, those with severe anemia may need iron supplementation. The drug listed above, yung tatlo kanina, have pregnancy warning. People should tell their healthcare provider if they are or may be pregnant so that they can have the right treatment. Hookworm infection are generally treated for 1 to 3 days with medication prescribed by your healthcare provider. The drugs are effective and appear to have few side effects. Iron supplement may be prescribed if you have anemia. In places where hookworm is common, those who are risks may receive preventative drug treatment to protect them from an infection. Prevention. Some preventative measures can help person avoid contracting a hookworm infection. These include wearing shoes, especially in soil areas with a high risk of contamination, using a barrier to prevent the skin from touching the soil when sitting on the ground, avoid consuming soil or unwashed food that may be contaminated with hookworm, not passing stool in the soil or outdoors, not using fertilizer made from human feces, covering children's sandbags, taking safety precautions such as wearing gloves and shoes when gardening, and treating pet dogs and cats for hookworm. Hookworm and pets. So hookworms can be presented in the household pets, including dogs and cats. So pati sa mga pet, maaari tayong ma-infect galing sa dogs and cats. So we should be more careful talaga para hindi tayo ma-infect. So the animal strain can spread to human in some cases. For this reason, the Companion Animal Parasite Council (CEPC) recommend fecal testing in cats and dogs, with more frequent testing in the kitten and puppy age group. The CEPC recommend at least 4 intestinal parasite tests in the first year and a minimum of 2 a year afterward. As with any preventative testing, the animal's health and certain risk factor will guide how often testing is needed. So, to prevent parasitic infection, the CEPC recommend year-round broad-spectrum parasite control and also recommend promptly removing animal stool from litter boxes in yards. Other public safety measures that people can take to reduce hookworm transmission include following leash law when in public, preventing ticks from wandering neighborhoods and scavenging, and following a vet's advice about deworming. So, in that way, maaring ma-less yung na hindi tayo ma-infect ng hookworm infection. And also, we should know yung mga symptoms at yung mga preventions para hindi tayo hindi tayo ma-infect, yun nga, hindi tayo ma-infect. And also, pag malaman natin yung symptoms para ma-treat natin kaagad, makakuha tayo ng gamot so that hindi na siya kumalat or hindi pa siya lumala. So that's all. Thank you.